Here's a sobering reality that should make every Pakistani citizen pause and think. While you're reading this, thousands of flood survivors in Khyber Pakhtunkhwa are battling not just the aftermath of devastating floods, but a looming health crisis that could spiral completely out of control. Ihtisham Ali, the health advisor to KP's chief minister, issued a stark warning on Wednesday, but has sent ripples through the medical community. He's predicting a dangerous spike in acute respiratory infections, skin-related ailments, and severe diarrhea cases across 11 districts that have been ravaged by floods. But here's where it gets controversial. Is the government's response adequate, or are we witnessing a preventable humanitarian disaster unfold in real time? Ali didn't mince words when addressing reporters in Peshawar, emphasizing the urgent need for humanitarian organizations to step up their game in providing clean drinking water, the most basic necessity for preventing disease outbreaks. He also stressed the critical importance of maintaining strict surveillance to prevent malaria from spreading like wildfire through vulnerable communities. Our health department is completely committed to addressing the urgent needs of flood survivors and will deliver comprehensive medical support to prevent any disease outbreaks, Ali declared with conviction. His words came just before he personally led an impressive convoy of 10 trucks loaded with essential medicines, nutritious food supplies, and crucial relief materials destined for the hardest-hit districts. And this is the part most people miss. The numbers behind this unfolding crisis are absolutely staggering. The Khyber Pakhtunkhwa Health Foundation organized this massive relief effort as communicable disease cases in disaster-affected regions reached a concerning total of 3,037 cases. What's even more alarming? A shocking 1,770 of these cases emerged within just the past 24 hours alone. The Integrated Disease Surveillance and Response System, operating under the Directorate General Health Services, released a comprehensive report that reveals the true scope of this medical emergency. Healthcare professionals have examined an overwhelming 134,230 patients throughout the flood-affected zones, with 40,635 of these examinations occurring within the most recent 20-hour period. The human cost has been devastating. The province has documented 330 fatalities directly related to flood incidents, while an additional 336 individuals have sustained various injuries. But here's where the situation becomes even more complex and potentially controversial. The infrastructure damage tells its own troubling story. The catastrophic flooding has severely damaged 57 healthcare facilities and completely obliterated 3 others, raising serious questions about the government's disaster preparedness and infrastructure resilience. The latest 24-hour period alone witnessed 556 new cases of acute respiratory infections being reported to health authorities. The medical challenges don't stop there. Healthcare workers are simultaneously dealing with malaria cases, bloody diarrhea, hypertension complications, dangerous dog and snakebite incidents, and cutaneous leishmaniasis, a parasitic skin disease that many people have never even heard of. Dr. Hiza Hayat, the managing director of the Health Foundation, joined Ali in announcing a significant strategic development. They've activated a district-level health cluster system designed to strengthen coordination between the health department and various partner organizations. This cluster approach aims to facilitate more targeted relief efforts and guarantee timely delivery of essential health services to flood-affected communities. But critics might ask, why wasn't this system already in place before the disaster struck? Meanwhile, Dr. Shahid Yunus, the Director General of Health Services, provided Dawn with additional insights into the government's comprehensive response strategy. He explained that the Provincial Control Room maintains constant communication with all affected districts and continuously monitors the evolving situation following the catastrophic flooding. According to Dr. Yunus, patients receive treatment at healthcare facilities where dedicated staff members work around the clock. while 32 strategically positioned medical camps provide free medications to those who need them most. The DG emphasized that his department has implemented every possible preventive measure to ensure that disease outbreaks don't spiral out of control, with specially trained staff working tirelessly on the front lines. We've strategically deployed experienced medical teams from Peshawar's prestigious Khyber Teaching Hospital to the affected areas of Shangla and Bunar, ensuring they have access to all essential medicines, he explained. Dr. Yunus also highlighted the proactive role being played by district health officers in Mardan, Swat, Swabi, Buner, and other severely affected regions, all working to ensure continuous medical operations in their respective areas. In a particularly noteworthy preventive measure, health workers from the well-equipped Bacha Medical Complex in Swabi have been dispatched to the most severely affected areas, where their intervention has successfully prevented potential disease outbreaks from taking hold. Additionally, the health department has distributed 2,500 mosquito nets specifically to Buner district as a crucial preventive measure against malaria and other dangerous vector-borne diseases. Dr. Yunus noted that local administrations in the worst-hit districts are actively supervising the work of private organizations to ensure that affected populations receive the high-quality healthcare they desperately need during this critical period. Up to this point, we haven't received reports of any major public health issues, as our dedicated officials are actively working to increase awareness about vector-borne, waterborne, and foodborne diseases among disaster-affected populations, while simultaneously providing them with comprehensive healthcare services, he stated confidently. But here's the question that demands an honest answer. Is this response truly sufficient for the scale of the crisis, or are we simply putting a band-aid on a much larger systemic problem? When natural disasters strike, they often expose the weaknesses in our healthcare infrastructure and emergency preparedness systems. What's your take on this situation? Do you believe the government's current response adequately addresses the magnitude of this health crisis? Or should more aggressive measures be implemented immediately? Are we doing enough to protect our most vulnerable citizens? Or is this another example of reactive rather than proactive governance? Share your thoughts and let's have an honest discussion about what it really takes to protect communities during times of crisis.